We're talking with Mark Angelini, who's the president of Mercy Housing Lakefront. You're the developers for the project. Kind of explain to us what this project is.
Sure. This is an opportunity to really bring a new mode of thinking about how to help homeless veterans receive all the services that they're going to need to help move them onto a path of self-sufficiency. So in addition to building a very high-quality residential apartment for them, we're also going to be making sure that within that building are facilities and an influx of various service providers so that they can get help in educational work, job training, mental health, health care, and just have kind of a constant caseworker person on them, working with them. And again, the goal here is to help the vets move on to a life of greater sufficiency and impact.
Is it going to be one large building with 65 units, or is it going to be some individual buildings?
Well, it's going to be one building with 65 units, but when you see the design, we've really been very conscious to demass it so that it really looks like a series of smaller buildings, but for the sake of construction cost and efficiency, it had to be put into one. But it will look like a very nice, modern apartment building at a scale that's appropriate for the setting here. We'll also have in it sort of a small community center area that, again, will be the source of service provision.
And, of course, with the VA being here, you've got the support for health issues that the vets would have.
Correct, exactly. I mean, what's really unique about this is that, to think about it, we normally work to bring in from a distance health care, educational services, and here it's really literally going to be in our backyard, both with the VA Illiana Hospital as well as the Vermilion Community College.
Now, you've had a lot of partners that we've all had to put together to make this happen today. Who are some of the folks that got involved?
Well, like I say, it takes a village to build a village these days, and it started really with the Veterans Administration, or the Department of Veterans Affairs, the folks here at the Illiana VA Hospital, Mayor Eisenhower, the City Council, Greg Hillary, and the board of the Danville Housing Authority were very critical, but the state of Illinois has committed a significant portion of the equity dollars that are going to build this facility. HUD is coming in with vouchers so that, again, we can accept veterans here who have no ability to pay rent. So somebody being here is going to be because they need to be here and can benefit from being here, irrespective of their ability to pay. So really, it was just about every level of government you can think of, local to federal, and then numerous private sources of funding, both from banks, First Midwest, U.S. Bank, but also very generous support corporately from Home Depot Foundation. They gave us $500,000 as part of their commitment. Citibank also gave us a very generous grant, and in both cases it was due to their company's commitment to helping veterans.
How do they find homeless vets for this project?
Well, we hope that one of the benefits of being right on top of the hospital here is that a lot of times that's where they find out. I think the VA in general is now trying to be very responsive to its patients, if you will, and as they come in for services, and I believe the annual flow of patients coming through this hospital is in excess of 8,000 people, they're really taking the time to not only treat that person for what they're in for, but to really start asking some questions to better understand their state of life. And that's, I think, going to be a primary source, is the self-identification as the VA brings in and really tries to triage these patients and understand what their breadth of needs are, not just that one medical incident that brought them into the hospital.
Now, what's the timetable on the project? When do you think it'll be finished?
Well, the easy part is building it, believe it or not. So we're breaking ground today. We'll have this facility built about a year from now, and the first veterans would be moving in, shortly thereafter. So let's say August, September is the target date right now, 2016.